Ready when you are.
All right. Hi, my name is Dr. Todd Sinett, and today I present to you the Back Pain Sufferer's Guide, which is basically a guide of what to do if you're suffering from back pain. So who am I? I'm an author. I've written 4 books on back pain, 3 Weeks to a Better Back, the Ultimate Back Bridge Stretch book, the Back Pain Relief Diet book, and my newest book called Sit-Ups Are Stupid and Crunches Are Crap. I'm also an inventor. I invented a product called the Back Bridge, and this is something that will help you decompress, elongate, and extend the spine, and can be really helpful in relieving back pain. I'm also the founder of True Whole Care, which is an integrated holistic center in New York City. So when we have back pain, there are really 2 types of back pain. There is the traumatic back pain and the non-traumatic back pain. So traumatic back pain is the type of back pain that's actually more rare, and that happens when you're feeling fine and you have some kind of trauma. You fall off your bike, you're in a motor vehicle accident, and the way that you treat a traumatic back pain compared to a non-traumatic back pain is very different. So traumatic back pain is you want to seek some help, you want to get some x-rays, maybe an MRI, you want to make sure that you didn't do any permanent damage or really hurt yourself. And again, these are the least common forms of back pain. And the more common types of back pain is something called non-traumatic back pain, which meant that your back pain has been building little by little or gradual. It's the type of back pain that comes about when you get out of the car and you'll say that your back pain came out of nowhere or you woke up with a really tight, stiff neck. And when I'm saying back pain, I'm referring to any pain that is as a result of or affects the entire spine. So that could be neck pain, shoulder pain, mid-back pain, lower back pain, hip pain, glute pain, whatever it may be. And those are the 2 types of back pain. So where does back pain come from? Back pain actually comes from 3 sources. And unfortunately in our society, we're only studying back pain as a structural imbalance. But that's only 1/3 of the problem. So back pain comes from structural imbalances, and that's muscle, bones, disc nerves, emotional imbalance, stress and tension, and diet or digestive imbalance, which we'll go into later. So emotional back pain is actually the #1 factor for back pain. Stanford University proved that many years ago, and that's where you have to start. So if you're having back pain, the first most important question you want to ask yourself is, what are you stressed out about? What's going on? How much tension you're bringing to the body? So in my book, 3 Weeks to Better Back Pain, we have a test called the Emotional Stress Test. It's on page 27. And allows you to answer a series of questions, and what it allows you to do is see if your back pain really is emotionally based or stress based. So there are a couple different readings that I would recommend someone do if they think that their back pain could be caused by back pain. And one is called Anatomy of an Illness by Dr. Norman Cousins. It's actually one of my favorite books, and it really highlights the power that emotions have on your overall well-being. And another book called Mind Over Back Pain, which was written by Dr. Sarno, who really changed many people's lives because he's believed or was convinced that back pain is 100% emotional. In my opinion, he was more incorrect than correct. However, he did help lots and lots of people. So self-care. So there's lots of things that you can do to help yourself when you're suffering from emotional stress or emotional stress caused by back pain. So one test that I really like to do is something called a twisting or emotional twist test. And what you're going to do is you're going to put your finger straight ahead and then turn and see how far you can turn. And then I want you to close your eyes, take some nice deep breaths, in for 4 seconds, out for 4 seconds, put yourself in a nice relaxing happy place, close your eyes, and then turn again. And if you can see yourself further after you've done the relaxation breathing, we know that your back pain or your tension is brought about by emotional stress. Another good thing is called tapping. There's a whole movement called the Tapping Solution, and you can check it out at tappingsolution.com, which I have nothing to do with. Or I created a self-tapping protocol, and that's on page 227 and 228 of 3 Weeks to Better Back. And what that does, it impacts the acupuncture circuitry. So when we're uptight and we're stressed, we block the flow of our energy within our body, or the Chinese would describe it as qi. So if these self-help techniques of going out for walks, exercising, meeting with friends, hanging out and de-stressing isn't working, or meditation isn't working, you really may want to seek some professional help. And the first level of help that I would recommend is something called a biofeedback counselor. And biofeedback is something that we do in our office, and we're able to measure the impact stress is having on your body. We measure your heart rate, your breathing rate, your skin temperature, your muscle tension. And when you're hooked up to monitors, we teach you to put your body in a meditative or relaxative state. If that is not working or you don't have access to that, try speaking with a certified therapist. Counseling and therapy can be very, very helpful. And if that's not working, you can then go to see a psychiatrist who can also prescribe medication to help stop the effects or the harmful effects the emotions are having and creating back pain. So a fun fact, and why we have a picture of a pill, is actually antidepressants. In a study, antidepressants actually work better in treating people with back pain than anti-inflammatories. And that actually makes perfect sense to me because, again, the number one factor for back pain is emotions and stress. So you really want to pay attention to stress and your emotions when you get hit with back pain. The next part of back pain that we're going to discuss is the nutritional and digestive side of back pain. This is the most overlooked concept of back pain and a factor that really changed my entire family's life. When my father was stricken with back pain and he was bedridden for 9 months, and the answer turned out to be his diet. So if you want to see if your diet is causing your back pain, you could just take the digestive inflammation test, and that's page 4 in my 3 Weeks to a Better Back Pain book. And another important factor is, I always say the quality of your bowel movement equals the quality of your back. So what you're eating is your input, and your bowel movements is really your output. So you really want to be healthy, you have to have good output. And here we have a picture of the Bristol stool chart, which shows you what your bowel movement should look like. So ideally, you should be looking for a type 4 type of bowel movement to make sure that your digestive system and that your body is excreting your waste materials properly. So there really has only been one book written on this topic, and that's by me, yours truly, and it's called the Back Pain Relief Diet Book. And it'll allow you to see if your back pain is caused by your diet, and then it's going to give you different dietary suggestions of which diets to try to help relieve yourself of back pain that can be caused by your diets. If reading the book and applying, making some nutritional or dietary changes on your own isn't helping you, I recommend you go see a nutritionist. They're really helpful in figuring out what vitamins, maybe herbs, what type of diet may be right for you. If not, you may want to see a primary care doctor to make sure that there's no underlying digestive issues, as well as a gastroenterologist doctor to do some diagnostic studies. So here we have 2 pictures of 2 different x-rays, and over here you have a picture that's fairly clear, and that's indicative of not having a lot of gas on x-ray. And if you can see over here how this is all covered up, that's the indication of a lot of gas on x-ray. So one main factor or cause of back pain is stomach upset, diarrhea and or constipation and or gas. So a lot of times patients will say they didn't realize how much gas they had until we change their diet and we get their body less inflamed and irritated. So now we're on to the most common aspects of back pain, and that's structural. And I really feel that posture is a major issue in causing back pain. You see this picture here, we're all hunched over, our computers were all looking down, and it became such a huge factor in causing back pain. I literally designed a product called the Back Bridge, and that's designed to put extension into your body. We're not meant to be forward hunched, we're meant to be standing tall. And doing 2 minutes in the morning, 2 minutes in the evening, a stretch of the Back Bridge really has helped thousands of people rid themselves of structural back pain. Again, another picture of the Back Bridge. So if you're going to seek some professional help for your structural causes of your back pain, there's different phases of this. And I call phase 1, where you want to see practitioners who are trained in treating your back pain, and that could be a chiropractor, physical therapist, and massage therapist. And these are all manual therapies involving exercises, stretching, loosening up the muscles, the bones, and a very good way to treat the back pain. If for some reason that's not helping you or clearing up, you want to maybe then go to phase 2, and that's going to see a physiatrist or what we call a non-surgical orthopedist. So they're trained in a lot of different methods to help structural back pain treatment, but not slanted towards surgery. And if all of those aspects aren't helping you, there is the orthopedic surgeon. Surgery can be a great solution, but you want to use it as a last resort. So there are some diagnostic testing for your back. There's x-rays, and studies have found that x-rays are actually the most effective and most efficient way to evaluate causes of back pain. It gives you just enough information. Most of the time x-rays are taken when you're standing or weight bearing and provides a very solid picture. MRI, which is actually the most common, is actually very much flawed, and the studies have shown that they lead to higher specialist consultations, higher specialist interactions, or more surgeries without better patient outcomes. Another main factor of an MRI, as you can see in this picture, is they're not taking weight bearing. So the picture of how someone is laying down or what their back looks like when you're laying down is very different than when you're standing. And another test is called a nerve conduction test, and that sees how you're able to evaluate how the nerves are functioning. And that could be used. A physiatrist will sometimes use that as well. So some suggested readings, I'm going back to my books. The first one I would really recommend is 3 Weeks to Better Back, and that's a self-diagnostic, self-help type of book. And then the other one's called the Ultimate Back Bridge Stretch Book, and using the back bridge, I've given you all the best back stretches as well as how to stretch out your entire body. So flexibility is key in ridding yourself of back pain. And then I have something called here the red flag. So you want to be careful if you're having back pain and you're suffering from something from foot drop, meaning your inability to get your foot off or you're dragging your foot when you're walking. You want to make sure that you have control of your bowel movements and bladder function. You want to make sure that you don't have a fever or temperature. You want to rule out infection as well. So don't minimize back pain. You really want to be very vigilant and make sure you see somebody to make sure it's not something more serious than just simple back pain. So what we have here is that we put 3 puzzle pieces together, and that's the solution to back pain. You need to get balance in your structural system. You need to be balanced in your emotional system. You need to be balanced in your nutritional or digestive system. If you're only seeing a doctor who's looking at one factor of this, you're missing 2/3 of the equation. You need to put all the puzzle pieces together. So thank you. Hopefully that helped you, and hopefully you'll feel better soon. Thank you so much.